All righty. All right. Well, hello, YouTube family. Welcome or welcome back to my channel. I'm Melinda. I'm a psychiatric nurse practitioner. I'm also a mother of two autistic boys. And today I'm interviewing Miss Alexis. She's a BCBA at a local autism center. And we wanted to just kind of have a discussion about what it is she does, kind of learn a little bit about what BCBAs do, and just kind of discuss autism. So, hi, Alexis. Can you just kind of introduce yourself?
Yeah. Hi, Melinda. I'm really excited to be here. Thank you so much for having me. Um,
Definitely.
as Melinda said, I work at a local center. I really got into ABA when I worked in foster care. I worked with kids with special needs that had autism, Down syndrome, other kinds of disabilities. And I got to work alongside a BCBA and really started learning about ABA and autism and really more about that field. And I realized there was a whole kind of world out there that I hadn't really explored yet. And so that's when I kind of got involved in the ABA world and started looking at kind of local clinics to see if I could learn more and serve in that way, and fell in love with it. So that was when I decided to go back and do my degree in that field and kind of just blossomed from there.
Awesome. So, how long have you been doing it?
So I've been in the ABA world for about 4 years now, and I've been a
Uh-huh.
BCBA for the last two. So
That's
really loving
amazing.
it and loving continuing learning and growing in that way. So
Awesome. Typically, in most ABA kind of centers, is there a certain age range that you guys focus on, or was there a certain age that you kind of feel like this is our age to kind of get in there? I mean, I know they said earlier the better, but is there like an age range, or how does that look?
yeah, so a lot of centers you'll see kind of between 2 and 12. Two is typically, when you start seeing some of the signs. Sometimes kids that are higher functioning don't get diagnosed till they're older, but we do see kids, as young as 2, and then as old as 12. Some clinics will do older ages. Really, the age range is more because we start to see insurance kind of pushing back a little bit more.
Gotcha.
Insurance in Texas is required to cover through age 10, as long as they meet medical necessity. And so, past that, sometimes you start seeing a little bit more pushback for services. But we have seen kiddos that are approved even beyond that. So
Oh,
it
good.
really just depends. Yeah. So I think they're starting to kind of realize, this is a lifelong thing that a lot of people struggle with and need sometimes more support even beyond that younger age range. So obviously, the earlier the better.
Yeah.
But there are starting to be some more options for older older people on the spectrum as well. So
Awesome. And I know you mentioned like options. So what would be something, say I have a child and they have maybe have more like low support needs or they're higher functioning. What would be some options if they're like maybe they're a teenager and they're trying to get a diagnosis or something like that? Like what are things they could do, to kind of help them have some support since maybe ABA is not an option at that point or a harder option to get into?
yeah. So I would say a lot of kids that do get diagnosed more in their teenage years, insurance will sometimes approve it. And so sometimes there's like in-home therapies and things like that that will offer more focused therapy. So that would be, more of that like 5 to 10 hours a week of just kind of really focusing in with them on um, their core needs. If it's like a social skills or some of those life skills that maybe they
Mm-hmm.
struggle with tolerating or working through, some of that rigidity that maybe they're struggling with changes in routine and things like that, a lot of times are really common things that they'll work on with some of that more focused treatment. So
Definitely. And I know I've seen with my boys that rigidity can be real when they
yes.
have things and things they don't want to do. So, are there any, I guess, unknown or unusual traits or things people don't think about that you've noticed that are pretty consistent with autism, like maybe like a misconception of autism or things that, people don't realize about autism?
Yeah, so I guess I would kind of say twofold. A lot of times with ritualistic and repetitive behavior, that can manifest in a lot of different ways that sometimes people don't anticipate. And so sometimes, you see the classic signs of
Yeah.
autism, but sometimes even like the intolerance for routine or toleration for different sensory needs, like maybe, they don't like certain feelings of towels or certain
Hmm.
um, feelings of pants on them or things on their skin, things like that. And sometimes people don't
Hmm.
think of that being a trait. Another one I see a lot is intolerance for certain foods. So they have a
Yeah,
really rigid tolerance for foods. Maybe they only like their carbs, or, there's certain snack foods that they'll love, but they struggle with the proteins or the veggies or things like that. And so that's a really common thing that we work on in ABA. Though a lot of times when people first come in, they don't even realize that that's an option or something that's tied to their autism. They just think, oh, they're a picky eater.
exactly.
Um,
And, and that's something I saw with my kids too, because I know for Andrew, specifically, like he didn't like cold things. So anything like ice cream or temperature, anything that was too cold in temperature, you can forget it. Like he was not going to eat it. He wasn't
mhm.
going to touch it. And even then with certain foods, it's almost like he had to touch it first to feel it. And then he kind of like licked it before he would actually eat it. And I kept wondering before we got him diagnosed, I was like, why does he do that? Like, why can't he just eat something? And then later
Yep.
realizing that was one of those tolerances things that he had. And also mentioning like things with as far as being able to like certain textures on their clothes. My boys never really had anything that they didn't want to like wear or touch. But one thing I did notice is um, the weighted vest was helpful to them. So maybe like that
Hmm.
extra weighted touch. Is there anything with that you've noticed? Because I know that sometimes like on the clinical side, we tell people that it kind of helps them to have better body awareness, kind of feel their body is there. Have you noticed anything? What specifically about those kind of touches or things are kind of helpful to them or supportive to them, or why they might like that?
Yeah. So OT kind of explores a lot more in depth of that, but typically sometimes we'll find kids find the additional sensory things just super reinforcing. So I had a kid that loved like squeezes, she just loved being squeezed on the arm. There was something about that sensory input that was just super enjoyable to her and
Yeah.
kind of helped her kind of refocus and calm down. And so sometimes we'll use certain things just as coping strategies, like squeezing a really, strong ball that they can, that gives
Mm-hmm.
them some feedback, or all your common fidgets, sometimes we'll use with kiddos if they struggle with just needing something in their hands or to kind of move around, get that sensory input. So we'll use those common things as replacement behaviors too. So
Good, good. And what about so when a kid, like I know like my boy, thankfully, yeah, Andrew recently graduated from ABA, so he kind of moved
uh-huh.
out, anything like that. So what do you see? What kind of I guess lets you guys know that hey, this child is doing well and we can kind of transition them beyond out of ABA? What kind of things do you see?
Yeah. So ABA is really individualized. And when kids come in, obviously their discharge criteria is going to look different for every child. But really, a lot of times when we come in, we're looking for them able to generalize the things that they really needed that were
Mm-hmm.
barriers to them being successful in like the school and the home environment. So a lot of times that includes like behavior reduction for some of their more challenging behaviors.
Mm-hmm.
It might be, being able to communicate their needs and wants effectively. That's a really common one that we look for is, can this child be successful in the classroom and able to advocate for themselves, in some way, whether that's, using a device or a picture exchange communication system, or vocally, obviously, is also, a big one that we look for too. But either way, just having that solid method of communication is a big one. And then, of course, being able to be successful in those environments if there's other kind of barriers with maybe attending, they can't focus, and then it's hard for them to even do work in the classroom, because they can't fixate on that, or they could be in that gen ed classroom but they're struggling socially. So kind
Mm-hmm.
of working through, those conversation skills and being able to initiate conversations with peers and answer questions when people say hi and things like that.
Yeah, those are really good things there. And now something like you mentioned, and which I probably should have even asked that pros of ABA. I think you just kind of listed a lot of those there. But so what are some things I guess that people don't realize that ABA can really help with? Because I know for me, people expect that you're going to help with the social emotional wellness stuff. You're going to minimize the behaviors. But what are some other things that you feel like ABA is able to help autistic kids learn that people might not realize? Oh wow, they're also going to address that when they're in there as well.
Yeah. So I think a lot of people think, ABA, they think behavior. So
Yeah.
if they have a kid with really challenging behavior, that's kind of a natural like go to. But not always the case if maybe they have a young kid that's struggling to communicate. A lot of people
Mm-hmm.
go right to, oh, we need speech, which is a
Mm-hmm.
great, therapy alongside ABA too. But ABA works a lot on that functional communication. So being able to communicate what kids want and need, and so that's always our first go-to if a kid doesn't really have that. And so I would say functional communication is a big one. I think, like I was saying before, with kind of expanding their foods. So
Mm-hmm.
restrictive eating can be one. And really, a lot of the targets that we utilize will increase tolerance for a lot of different things. We've done like increasing tolerance for a dentist visit, a haircut,
Yep.
those things that a lot of times become barriers for parents because they can't even take them to the doctor because the doctor doesn't know how to respond. And then the kid,
Yep.
I have kids that have never been to the dentist before at 5 years old because they know as soon as they sit in the chair, they're not going to tolerate it. And so, being able to work through some of those tolerance things slowly in small steps and can really help them be successful in some of those community environments that
Oh yeah.
otherwise they might not be able to be a part of.
And I know for that, for at least for my boys, you all utilize a lot of times those social stories. So, for example, like for Andrew having trouble going to the doctor, getting a haircut, they would talk to, okay, this is what's going to happen, and kind of having them be able to kind of go through what that would look like for them. Are there other tools or things that you guys utilize with APA besides things like this?
Yeah, so a lot of
Can
times
you
we'll
also
use.
can you I'm sorry, also can you also explain maybe to people who don't know what a social story is, what that is too?
Oh, yeah, for sure. So, a social story, a lot of times, is just a very basic kind of rundown of expectations. And so, we really customize that to the individual needs of the kiddo. So, a lot of times, if they're saying, going to get a haircut, we'll tell them, hey, these are the things the hairstylist might use. They might use a buzzer, they might use some scissors, and just along with that, some visuals of what that would look
Mhm.
like. And within that, usually we'll talk them through some of those things. And if they have questions, we can help answer those through that social story. And so that's a really common thing that we'll utilize. Another thing is shaping. And so shaping is really breaking down the skill into very small components. So
Mhm.
I use an example, I do a lot of toilet training with my toddlers. And so a lot of times we really start just by breaking down tolerating transitioning to the bathroom more frequently, tolerating sitting on the toilet for longer periods of time. If they start out with being able to tolerate it for 30 seconds, maybe we build that up all the way from 30 seconds to like 6 minutes so they can tolerate those longer practices.
Yeah.
And then, washing their hands and building all of that into smaller components. So,
Awesome. I know I have had some people in the comments before comment that because I mean I'm a huge proponent of ABA. It's been integral in my kids' life, but I do know that some
yeah.
people maybe because they're older or and gone to other places, they haven't had a positive experience with ABA. Have you ever heard people say that, oh, negative things, or what are some negative things that you've heard when people or reasons people are more hesitant maybe to want to try ABA?
hmm I think the biggest thing is, ABA has a history. When it was first starting as in the field of behavior, there were some
Yeah.
common misconceptions of just it being very punishment based and, maybe more punitive. A lot of times parents fear that when we're teaching their kids how to express themselves, we're going to become like make them into compliance robots or things like
Yeah.
that. Or maybe I had a parent one time ask me, like, are you going to withhold water and food from my kid until they ask for it? And absolutely not.
I
We're
know.
we're under a strict compliance code that we really follow, and ethical codes to work through with just being really reinforcement based, making sure the environment is things that
Mhm.
are really motivating for that child. So if we don't
Yeah.
have things, we get things that are going to be reinforcing for that kiddo and to motivate them to help and build on those requests. And if they can't communicate for water and food, of course, we're never going to
Yeah.
deny those basic needs. And so I think with the punishment thing, that's very much a thing of the past. And that's really not even a common practice utilized in ABA at all. Really, we focus on how can we reinforce the good things and teach the
Mhm.
good things that we can then help decrease some of the more challenging things or decrease the
Yeah.
attention we give to the more challenging things so we can increase that more adaptive behavior.
Yeah.
um so
And I have seen that too, because I remember that was one of the things coming in that was very much reinforced, at least for us, for the center that you guys work at, was they were very big on, look, this is very much positive reinforcement. We do not use negative reinforcement because negative, we don't want to focus on negative. We focus more on the positive because that's going to more motivate the child to want to decrease the negative things. And so that was
yeah.
kind of the experience that I saw with ABA. And that's kind of what I was thinking too, that maybe, again, in mental health, because, in my personal job, I see patients and things in mental health. And even on the psych side, back in the day, we treated things like schizophrenia or other disorders in hospitals. The same treatment back then is not the same as it is today. And so I was thinking kind of similar, like over time, we kind of learn and adjust. And so now they're like, okay, those are maybe not the best way to do things. Let's kind of focus more on these things. And so I've definitely noticed some of those things. And it's also been helpful with helping me learn better ways to parent my child, doing some of the focusing more on the positive things because, naturally as a parent, at least how I grew up, it was more like do it this way, strict, you this, or you lost this thing. And so it almost had to retrain my brain to learn that, okay, no, I'm not going to take away something from my child. But instead, if they do something wrong, okay, but I'm going to reinforce when they do something correct. So say my child had a meltdown, I just can't ignore the behavior as long as he's not hurting himself. But when he stops crying, I celebrate. Oh my gosh, I'm so proud that you stopped there. Hey, you want to talk about it? And it was just the opposite way of thinking because normally you want to be like, stop crying. But through ABA, I was taught, okay, no, let's not do the negative, but let's reinforce when they do something positive and reinforce them that, hey, when we use our words or when we say things. And I know now it's just so amazing for us. Even my Andrew or Jason be like, I'm mad. Like, hey, I'll take that. I'll take that over food any day. So, and can you speak to also about that, like how you guys work with parents? Because I know for me, that was a huge part of it and it was a requirement. And I actually really appreciated that you all did that.
Yeah. So that really can vary based on the parent need. And we really try and meet each parent where they're at. And so a lot of times when parents first come in, sometimes they're still just shocked by the diagnosis or still in a little bit of that denial. And so sometimes just supporting them in that role of what questions do you have about autism? Like what questions do you have about ABA, because a lot of times we're really one of the first providers that they interact with following the diagnosis. And so really just trying to create that supportive role. And then some parents are really interested in just kind of more problem solving. So they have certain things that they really want to work on in parent trainings of, hey, my child's really struggling with these long tantrum behaviors. We need to decrease these in the home so we can, have a more successful morning routine or, get them to sleep at night, things like that. For some parents, they really want to learn, like, how do you guys implement all these methods in the clinic and what can I implement at home, So that's what we'll focus on too. And so we have different curriculums and things. There's a lot of different methods out there that we can use in parent training. And when I do parent training, I like to try and just customize it to what the family is valuing most at that time. So if it's just, hey, we need all the things, we just need a foundation of what is ABA, what is autism. Yeah, then I'll really try and, just go through the basics and then customize that to the individual things that they're really struggling with. And some parents come in and they're like, hey, these are our top 3 priorities. Like we need to focus on these, trying to meet them where they're at with that so that, at least from the behavioral perspective, we can target those things in the way that they need, and then build from there. So.
Gotcha. And as far as I know for me, another thing was that ABA pairs really well with the classroom and really well with school. Can you kind of speak to that in ways that you guys can support parents when it comes to school systems or things or getting things implemented in school for their kids?
Yeah, absolutely. So when we start looking at, implementing kids back in the school environment, and that's going to look different for each child. So, with our kiddos that maybe are already in the school environment, we're going to try and collaborate with those teachers, with those professionals, and help them say, hey, these interventions have really worked for them in the clinic. Maybe that's something we could work on in school. We can also go to, their art or IP meetings and things like that. If there's just a need for another kind of advocate in that room, to say, hey, and a lot of times parents have never done anything like that, so they don't know what to expect. So just helping prepare the parent for what might be helpful for their kid in school and what kinds of supports maybe might be beneficial. So,
and I do think that's huge because I know that's something you guys offered our family, and it was great because, like you said, a lot of us parents, that's not something we deal with every day. This is the first time a lot of times with their child if they've never had a child with any type of disability or needing those accommodations. So we don't know to ask. We don't know what the school can do. We don't know what our rights are. And so even though the school tells us some, there's still a lot of things that we don't know. And so it's very helpful to have somebody who's there to maybe who knows the system better can fill in those gaps, can ask those questions we don't know to make sure our child is moving along appropriately. And I know in our situation specifically, you guys were helpful in helping us realize that Andrew didn't even need to be in special education. And we, like person helped us before. And so that was really huge for us because again, we don't know the criteria, we don't know things legally. You just go off of what a school recommends. And unfortunately, sometimes the recommendations are more based off of what's convenient for the school than what's going to be best for your child. Now, again, I'm not saying this, please don't take this, people, as I'm trying to bash schools at all. I'm just speaking from my own experience in this case here. So, but yeah, so that's been super helpful there as well, though. So, yeah, so, well, I really appreciate this. And I definitely want to have you back again. I feel like this has been wonderful. Anything else you want to share about ABA or any other things you feel like would be useful for my community? I have some people are autistic themselves, some people have kids, grandkids. Anything else you just want to share in general to kind of help them with ABA or anything in general?
Yeah, I would just say, ABA can really be helpful for people on all levels. We see a lot of different levels, people coming in that have just been diagnosed that, maybe aren't even talking yet, all the way up through kids that really just need a little bit of support with social skills. And we can really customize that and be beneficial to all kind of walks within the journey. And, like you were saying with the parents and being a support to parents where they're at with that. And some parents don't need as much help as some people are just, again, that really new level of, hey, this is brand new, tell me everything. So I think it can be really beneficial, and it's one of the most recommended treatments for autism right now, one of the most evidence-based. So
and also, you also have, I believe it's a website or a blog about autism for people if they have additional questions or things about autism. Can you share that with my, and also I'll also put her information, link it in the description box as well. So you can also be able to find more information about Alexis and things about autism as well.
Yeah, so I started Autism Parent Supports back in February. And really, that was birthed out of realizing that how much parents really look up to providers to provide all the supports, resources, external resources for, hey, we got diagnosed and I don't know where to look for speech services. I don't know where to take them to the doctor. I don't know how to work through this behavior, all kinds of things that parents were really looking to us to kind of answer. And I was like, wow, I need to use this outlet and help parents that maybe are just feeling lost after the diagnosis and trying to figure out what services do I focus on? Do I just put my kid in school saying, go ahead and enroll them in this early intervention program. And then, ABA saying they need full-time ABA, and then I need speech and OT and PT. And there's so many things that it can be so overwhelming. And so, just trying to help parents with topics that might be meaningful to them in that new place of, we just got a diagnosis, now what? And a lot of times ABA centers have wait lists and things like that. So just offering some information of, how do I start helping my child even from wherever we are, even if that's not getting into ABA right away or, school right away or whatever that looks like.
Gotcha. All right, Alexis, I really appreciate you speaking with us, and I'm sure my audience will love you as well. And guys, again, if you have any questions, comments, things you want me to ask Alexis, because I'm definitely going to try to have her back for another talk later if she'll come back. Comment that down below. Thanks, you guys. Make sure to continue to watch these videos. If you're not already subscribed, please make sure to subscribe. I put out new videos once a week on Sundays, and I'll see you next week for a new video. Bye.
Bye.